Stigmatization is one thing, sheer disobedience is another. Our reporter Josh Onsare has been following up to seek and understand whether and gauge whether Kenyans are following the health guidelines stipulated by the Ministry of Health, and joins us live now. Josh, a very good afternoon to you. At the place where you are at, are people observing the guidelines?
Yeah.
Josh, if you can hear me, you have been up and about this assignment till morning.
I'm getting you live from the CBD, Nairobi CBD, whereby we are really following up on these situations whereby you find Kenyans are disobeying the orders that are given by the Ministry of Health in terms of combating this particular pandemic of coronavirus. And earlier on, we tried to look at how people are behaving in town, people are behaving in different markets, and we realized that Kenyans are not adhering to these particular measures that have been put in place. People are not wearing masks, people are not sanitizing, and also people are not washing their hands regularly as it is recommended by the Ministry of Health. And also you get to find that other Kenyans are complaining that the cost of living is high, and you'll find that they don't have enough money to buy the sanitizers, to buy the masks. So they divert all the money that they have got to keeping up with life. For example, getting food, and they say that life is not easy outside here because of no jobs. The government has put serious measures to ensure that the coronavirus is done away with, especially in this time the whole world is battling this particular pandemic. And also we found out that when we go to these bus stops or bus stations, you'll find that people are not following those rules. For example, there is no sanitizer when you are entering Namatatu, and then the mask is half worn. You'll find that it's not worn as it's expected. So you find it difficult in fighting this particular virus that is now serious in the whole world. As per yesterday, the Ministry of Health announced that currently the total number of cases which have been confirmed to be positive in the country, they are 490, and whereby we found that 25 yesterday were reported or were confirmed to be positive. And another thing that was found is that the number of those who are recovering is increasing now and then. So it's a personal responsibility for the Kenyans to follow up on the right procedures which have been laid down by the government to ensure that this virus has been done away with. So I have one boda rider who is going to talk to us. So you can come and talk to us, sir, so that you give us your views on this particular pandemic. So he's coming with his own motorbike. So give us your name, please.
Joseph Waweru Dongo.
Yes.
Yes.
So are you following the laid down measures?
Yes, I follow them, but sometimes it is difficult to follow them because some of us, we don't afford to buy the mask. Yeah.
Maybe now you have, when you get, let's say, the person who you want to take somewhere as the person you will be the passenger. So how do you protect that passenger so that to make sure that this virus does not get to your passenger as well?
Okay, number one, we sanitize our customer, and then if we don't have the mask, we used to buy the mask. It is only 50 bob. We forced to buy the mask. Yeah.
And maybe we can talk about this particular, for example, there are free masks as boda riders. Are you getting them?
No, not yet. Okay. Yeah.
Okay, Abubakar, that is the point. As we can be able to see, he has talked to us about what is really happening. And those are the challenges Kenyans are going through as far as this pandemic is concerned. And we have people that we call the opportunists who have taken up this opportunity to start hawking masks without following the laid down precautionary measures to ensure that the COVID-19 is done away with, so that now the country can go back to normal. But in real sense, as my camera person will just focus to this other side, we'll be able to see the motorists are working, everything is in progress. So my camera person, you can really focus so that we can be able to get the real picture of the town and also how things are being done. And you can be able to see the matatus are operating. Everything is in progress, and you'll find that everything is working on well. Abubakar.
You go, let me ask you one question. The person whom you spoke to and the people whom you interviewed earlier on in this assignment alluded to questions of cost, but there are cost-free measures such as social distancing that can be observed. Is it being observed? All right, seems you have lost Josh there, but nonetheless elucidating on whether people are observing social distance and some of the requirements in as far as the health guidelines are concerned. Josh, thank you. Moving on to Wajir County now. The county has recorded 2 cases, and that stands 2 since the last announcement made by the county government on the same 3 days ago. The 2 COVID-19 positive patients were on their way back from livestock trade in Somalia and were later intercepted at Diff Division in Wajir South. Cross-border pastoralism could escalate the number of coronavirus in northeastern region if measures are not put in place. Our very own Isadin Haji joins us from Wajir now.
Well, Abubakar, the number of positive cases for COVID-19 in Wajir County still hang at 2. The governor of Wajir, Mohammed Abdi Mahmoud, on 30th last month, gave a press statement indicating that 4 pastoralists from Garissa County had traveled through the county, through the border of Somalia with Wajir into Mogadishu for pastoral trade. Later on their way back to the county, they were intercepted by security actors, later on transferred to Wajir and quarantined in one of the quarantine centers. Later on, one person was tested positive. 24 hours later, the second person tested positive. This is an issue that has raised eyebrows in the residents of Wajir on cross-border issues and pastoralists moving from one place to the other. We're now joined by one of the residents from Wajir County, who of course will tell us his feeling. Kindly welcome, and of course keeping that 1 meter distance. Start with your name and what do you feel? Tell us about your feeling. Do you feel that you are safe in this county now that this cross-border thing has raised some eyebrows and now we have 2 positive cases of corona?
Thank you, Isadin. My name is Abdi Bilo. I'm a resident of Wajir town. Honestly, cross-border issue is a very big threat, not only in terms of transmission of COVID-19, but also it previously posed a security threat. So it's the issue of COVID-19 is not only affecting Wajir, but it's affecting all over the country as far as the cross-border issue is concerned. And as pastoralists, we have got no restrictions in terms of movement. You can see pastoralists from Wajir already grazing into the other side of Somalia, Ethiopia, and vice versa. Recently, even in Busia, in Isebania, around those areas, these are challenges being faced. In Mandera, I'm told the county commissioner is really overwhelmed because people cross over to Bulahawa for prayers and come back. They sneak, not knowing the danger they pose to themselves and the people around. I think it's a very big issue and it needs to be addressed. As much as the security apparatus have put their surveillance in place, there are so many panya routes where people get through. Our borders are not having walls and they are not sealed. So there's need to really pull up our socks and really be vigilant. Even residents have got are duty bound to inform the government of the people, because it's my cousin who crossed over to Somalia, it's my relative, it's my nephew, it's so and so. And tomorrow they'll infect me, they'll infect you, and they'll infect the rest of Wajir country. Now at 2 we say Alhamdulillah, praise be Allah, because this is still a manageable number. But we know there are hundreds of livestock traders who are out there, and we don't know their fate. They'll come back, they are sick. Rumors has it now that already 20 livestock traders are trying to find their way through Al-Waqa to Wajir North. If that is true, then we are standing on a time bomb. Yeah.
Well, thank you so much. Abubakar, just to give you and highlight, the County Commissioner of Wajir, Mr. Jacob Narengo, has earlier commended security actors for actually intercepting the four pastoralists who came from trade from Somalia through the border of Dif in Wajir South. And these are some of the issues that are coming up, and of course pastoralists crossing across the long porous borders within these counties, and that could really pose challenge to security actors. And the big question, and what people here are asking themselves, is how many more people could have crossed from the other side coming through these counties? Abubakar.
All right, from Wajir County, let's take another story. As different counties in the country continue to battle the first spread in COVID-19, it's evident that majority of counties are incapacitated, and as it stands now, only few counties can conduct COVID-19 tests. However, the counties are blaming the national government for their inadequacies in combating the virus.
Needs, and yet we are not able to procure outside of KEMSA. KEMSA, as far as I'm concerned, does not have the capacity really to supply all the medicines and all the equipment that are needed to provide healthcare in this country of ours. It's a monopoly that is dangerous. When they are delayed, medicines are delayed, it can even lead to the death of people. So that is important to state that it has been our biggest headache. We got part of the money of universal healthcare was sent to KEMSA with drawing rights, and we've been able to draw, but still there's some money left because they don't have the equipment and they don't have the medications that we need. For example, in Machakos, we have the Machakos Cancer Center where we're offering free cancer treatment, including chemotherapy. And so we find at times they may not have medication, and we are restricted from buying it from outside KEMSA, and yet these are matters of life and death. If you delay medication for a week for a cancer patient, you're basically confining them to death. So that is an essential matter. Chairman, Kuti.
Yes, what specific medicines and medical supplies have county governments been granted drawings rights to under the earmarked funds that are transferred to KEMSA? I think we've been, this is not a pool, it's not a push system. You know, KEMSA used to have what's called a push system where they have list of essential drugs that they push to the counties. It's not that way. It's a pool system where counties themselves, the pharmacist, the county pharmacist, will make a list of all the things that they require, and therefore this list is dependent on the demand of the county. It is not a prepared list like before evolution. I think there was that push system where KEMSA had a list of essential drugs and they just sent to the counties. No, this is a pool system where counties send in their demands according to the need.
Elsewhere, Bura Member of Parliament Ali Wario has condemned the killing of a 14-year-old herder that took place at the border between Kitui and Tana River counties. The attackers, who were armed with arrows, managed to round up 50 goats. Zablon Masharia with the details.
The 14-year-old girl was herding together with her relative Ali Ahmed before she was killed. Ahmed was later shot from the back with a poisoned arrow.
Wale mauaji imetendeka, kulikuwa na watu wawili, msichana ambaye alikuwa na mchungaji mbuzi akauawa hapo hapo na maiti yake ikakosekana. Mtu ya pili alikuwa huyu mtu amedeti sahi hapa kwa hii hospitali, ndio tulipata akiwa amedungwa mishale kutoka hapa mgongo na ikatokesea hapo.
According to Deria Musa, Bangal resident, they moved to the scene upon receiving the news and found the brother's body badly injured. They took the injured to a nearby dispensary where he was administered and was later taken to Garissa Hospital for specialized treatment. Ahmed succumbed the injuries from the poisoned arrow.
And during the surgery, we found that he had injuries. The arrow had passed through the right side of his large intestine and made 3 holes before it went through the abdominal wall.
The area member of parliament, Ali Wario, linked the killing to protracted disputed border between Tana River and Kitui counties. The body was later released and buried 90 kilometers from Garissa town. Zablon Masharia, TV 47, Nairobi.
Elsewhere, Eldoret journalists donated foodstuff to the less fortunate in the society. They visited over 20 needy families in Langas Ward, Kapsaret Sub-County. Speaking to the press, Uasin Gishu Association Chairman, Journalist Association Chairman James Getaki said their aim was to caution the affected families from COVID-19 hit.
Sema ni ugonjwa inaitwa rheumatoid arthritis. Nila kutibiwa tu na kupona. Lakini sasa nimeshindwa ani. Sina namna. Hata nikisema niende hosi, sasa hosi yenyewe kule unahitaji kitu kama chakula nini na watoto tena. Yaani ni ngumu tu sana. Ngumu tu sana. Ningependa sana niende hata ndibio, lakini sasa hata wakati yenyewe ilipotea.
Ali imekuwa ngumu, mzali ondoka akatuacha na mtoto mdogo. Sasa msaada ambao ningehitaji ni kama kungekuwa na msanii yetu mwenye anaweza kutulipia nyumba.
Familia zina changamoto. Tukiangazia mmoja kati ya wale ambao tumeweza kuwatembelea kule Kipkaren, tumeweza kufahamu kwamba familia nyingi kwa sasa, wanaume ama wale mabwana, wameweza labda kutekeleza majukumu yao na kuachia kina mama.
Kutembelea baadhi ya familia ambazo tumegundua katika mitaa duni wanaathirika. Baadhi ya kina mama wameachwa na waume zao, na pia kuna wale ambao wanaishi na ulemavu, pia hawawezi kwenda kutafuta. Kwa hivyo tumeona kwa njia ambayo tunaweza kwa wakati huu tuweze pia kushirikiana nao na kuwasaidia.
Well, from the philanthropic gesture of journalists and scribes in Eldoret, it's time for us to take a short break here on News Deck. We'll be back after this break with more news.
Sarma Enterprises Limited. We are your trusted and reliable supplier of quality timber products, construction material suppliers, which are river sand, ballast, building stones. Visit our website on www.sarma.co.ke. Sarma Enterprises Limited. Quality materials for quality structures.
The coronavirus is spreading rapidly across the world, and currently there is no cure or vaccine against it. It spreads through tiny droplets when infected people speak, cough, or sneeze. These droplets can land on surfaces to be picked up by hands and are impossible to see with the naked eye. But just because you can't see them doesn't mean that they are not there. And you may get infected if you touch your face, nose, mouth, or eyes. To help stop the spread of the virus, we all need to do the 5. 1. Follow these steps to wash your hands frequently with soap and water for at least 40 seconds. 2. Cover your mouth with your bent elbow whenever you cough or sneeze. 3. Avoid touching your face. 4. Avoid crowded places. Keep a safe distance from other people. 5. Stay home if you can, especially if you have any of the symptoms. For more information, visit www.who.int.
Welcome back. Thank you for choosing to stay with us. This is News Deck. I'm Abubakar Abdullahi. Moving on, Ann Mumo, Kitui nominated member of County Assembly, also a trained Siwa from Kitui Rural Constituency, is locally making sewed face masks and donating them for free to the less fortunate in the local community. Have a look.
Niliangalia vile distribution ya masks zinaenda, na kwa ukweli watu wa kwetu hapa ni wanyonge kwa mapato, na nikaona ya kwamba mheshimiwa ambaye ni president wetu Uhuru Kenyatta kila kukicha anahimiza watu wakae nyumbani, watu wavae mask, lakini nikiangalia pote nikitembea watu wa kwetu ni wanyonge kwa mapato. Hawana hizo pesa za kununua mask kwa sababu unakuta zinaenda kwa 160 shillings, unakuta zinaenda kwa shilingi 200. Nikaona nijitolee ninunue rolls za material, na nikaenda nikatafuta mama wa maendeleo ya wanawake na nikamuuliza anisaidie kutafuta wasichana ambao wameshaenda training na wako na certificates zao, kwa sababu niliona pia nitakuwa nimeempower the youth na pia nitakuwa kupitanishia wao kwa mambo ya dunia, kwa sababu an idle mind is a devil's workshop.
Elsewhere, some 30 households in a slum in Kisumu have everything to smile about. This after their landlady reduced their rent by 30%. Daniel Dembede with the details.
More than 31 rooms which Felgona collected 3,000 per month for each single room will now see her tenants pay 2,000 shillings per room per month.
Niliona ya kwamba ni vizuri hata kama ni malipo 3,000 nikate bei irudi 2,000. So watalipa 2,000 kwa hii mwezi na mwezi ujao. Tuone vile hali inaendelea, ndio tunaweza rudia tena waanze kulipa shilingi 3,000 vile walikuwa wakilipa.
Felgona adds that she will not evacuate tenants who will not be able to pay their rent during this tough period.
So I calculated what I'm spending compared to what they are spending. Nikaona ya kwamba wacha tukue sawa. Kuna wengine hata wameniambia hawawezi kulipa mpaka mwezi wa 7. Hata tumekubaliana, si shida, watalipa tu.
Some of the tenants could not hide their joys and welcome the kind gesture of their landlady.
Na tumekuwa kama mimi nimekuwa nikilipa 6,000 na alinikatia akaniambia nilipe 4,000, ambapo ilikuwa surprise sana because sikuamini atafanya kitu kama hiyo, na nimefurahi sana kwa kitendo alifanya, na Mungu azidi kumtendea mema.
Nashukuru landlord wangu kwa kukatia sisi rent kwa sababu la janga ambalo limeathiri sekta ya uchumi, haswa si Kenya tu ila ni dunia nzima.
Many people in the slums can hardly find menial jobs at this time since workplaces have been closed down or workload has reduced in keeping with COVID-19 containment measures. Daniel Dembede, TV47, Kisumu County.
Elsewhere, for 4 months now, residents in Makadara area are forced to walk to their neighbors' premises to ease themselves. They say they are not able to access their toilets due to the breakage of the main pipe to the sewer that has been overflowing from the main home.
Kutoka mwezi wa 8 hakuna kwenda choo. Watu wanapupu kama wanatupa mapui nje. Hatukienda kwa watu wakanjwa wanatuambia tutoe ndoo. Sengine wanakuja wanachanisha mapupu huko kwa barabara kama hata ni kama wafungui kitu, unaelewa? Sasa hii choo hata tuendangi, choo silifungwa. Tunaendanga kwa manimba. Ama za nyingine mtu anakuambia huku kwetu hata kwetu kumencha, unaelewa? Kama ni usiku na umekazo utafanya nini? Unachukua karai unaenda unapupulia unatupa nje. Watu wanaimba wakikuja waona mapupu iko hapa wanakuja kutuambia si ndio hatuna choo.
I pray they find a solution to that, because that is part of the very basic minimums of human rights and human wants. That brings us to the end of today's edition of News Deck. I am Abubakar Abdullahi. Thanks for watching. Bye for now. Enjoy the rest of your viewership.
The coronavirus has negatively affected the business environment not only in Kenya but also globally. We at TV47 are in support of measures taken by the government of Kenya to safeguard the public and keep livelihoods going. In this regard, we wish to appreciate the business entities that are resilient and putting on the Kenyan spirit to sustain their businesses. We wish to support your business